Doctor is in, as he is every Friday, and our topic today is comprehensive breast cancer care. It's important to know that if you are diagnosed with breast cancer, you don't have to make decisions alone. You can work with a team of professionals every step of the way. And Dr. Scot Ackerman is one of the First Coast's leading oncologists. He is here today to talk about the support that is available here on the First Coast. So thank you for being here, Dr. Ackerman.
Thank you, Casey.
So let's talk a little bit about what exactly is comprehensive breast cancer care.
Well, in all cancers that we treat cancers, as I've mentioned before with you, with three modalities of treatment: surgery, chemotherapy, and radiation therapy. And those three modalities are used, usually all or in part, some of them or all of them are used in the treatment of all cancers. In breast cancer especially is where the coordination of radiation and surgery and chemotherapy is very, very important. And we have seen improvement in outcomes, improvement in survival, diminishment of recurrence rates in breast cancer over the past 20 years. That's due in large part to the fact that we're diagnosing breast cancer more early through screening mammography and breast self-examination and those sort of things. But it's also due in a great part to the fact that we're better coordinating our care. And so we have a team of physicians, and and what we like to do is get together as a team or coordinate together as a team in a prospective way, meaning that when a woman's first diagnosed with breast cancer, be it a mammogram that's positive and then maybe a biopsy of the tumor, it's at that point where you want to have the cancer team get together and have input as to what is the best treatment course for the woman. So this team, as I said, is usually made up of a surgeon and a radiation oncologist and a medical oncologist. They do the chemo, radiation, and surgery, of course. But we also have involved in that group a pathologist who can review with us the tumor specimen. We can look at it together with the pathologist. We like to have a radiologist available as well to review with us the mammograms so we could see exactly where in the breast the tumor is. Perhaps additional imaging studies were performed, like an MRI of the breast or a PET scan or those sort of things. And we also like to have, as part of that team, genetic counselors, oncology nurses, sometimes navigators, people that help women navigate through the very complex system. And together as a team, we're able to identify better which women need treatment, which women don't need treatment, which women need extensive treatment, maybe women that need less extensive treatment. And by identifying who needs chemotherapy and who doesn't need as much chemotherapy, who needs radiation, who doesn't need radiation, we can have better outcomes for women because we're really tailoring the care for that woman based on lots of parameters, based on her overall health, her other medical problems, based on the radiological images of the breast, where in the breast the tumor is, based on the genetic makeup of the breast cancer cells themselves, not just how it looks under the microscope, but all sorts of genetic markers. We look at that as well. So in this comprehensive care that I talk about, it is having those inputs from the different physicians. It's also having inputs from genetic counselors. And also, lastly, with that, is having support for the woman, support going through cancer treatment and support after cancer treatment as well.
So it's really a multifaceted approach. It's not just one direct line of sight. There's all kinds of different components that come into it, which is fascinating. But what about the support programs? What kind of support programs can cancer patients get?
Well, support is very important for all cancer patients, and especially in women with breast cancer, because in breast cancer there's so many options for treatment that it can become overwhelming, it can become confusing. So it's very important for the first step for a woman with breast cancer. It's very important that she has the support of her family and friends. It's always good for me to see a woman come in with her husband or her daughter or her mother or her sister or a church friend, because when she's meeting with the physicians for the first time, it's a bit overwhelming, and there's lots of questions that she might have, and there's lots that she's told that she may not remember. So it's good to have the support from family and friends. And then through treatment, it's good to have support from the oncology social workers, and it's good to have support from the oncology nurses as well.
Yeah, and I'll tell you, it must be overwhelming in your experience to have these women come in and your mind must be going a million miles a minute, and you probably are not listening to everything because you're thinking about what your ultimate fate will be. What advice would you give to women who, who should they bring with them? Obviously somebody pretty close to them.
Well, I think it's always good to have an immediate relative, your husband, your wife, your daughter, not your wife, your husband, your daughter, your mother, someone like that to be with you to help answer the questions, help retain what you're told by the physician.
And you have this at your practice, I'm sure, this multifaceted approach.
Well, it turns out we're very lucky here in Northeast Florida that most of the medical practices that are involved with the care of cancer patients do have a comprehensive approach to cancer patients. We certainly do in our practice. We have social workers and we have oncology certified nurses, and we provide all this support and this real comprehensive approach.
Which is great. Well, thank you so much, Dr. Ackerman.
Thank you,
we
Casey.
certainly appreciate you being here and for sponsoring this segment. And Dr. Ackerman, he is with us every Friday. And next week, we will be talking about a very timely topic that has been in the news, meningitis. So for questions regarding today's topic or any other health questions that you might have, if you want to do so, just visit firstcoastoncology.com. You can confidentially submit your questions to ask the doctor, no matter what they may be.